Here I'll be asking Dr. David Schechter a question that you all want to know an answer to. Dr. Schechter is a TMS leading physician. He actually has the most continuous years of experience treating TMS, or mind-body syndrome, psychophysiologic disorders, out of any physician, since Dr. John Sarno, who he actually studied and learned through, has since passed away. Dr. Schechter has an incredible book, Think Away Your Pain. He also has his own practice in California. He's an incredible physician. And the question that I ask him here is, what is the cause of the tension in my pelvic floor?
Hi, this is Dr. David Schechter. I'm presuming from the question that you've been diagnosed as a pelvic floor problem, that you're having pain and tension in the pelvic floor, and I'm presuming that you've already tried treatment for your condition, which may have involved physical therapy for your pelvic floor or other physical treatments. So you're asking me now, why does my tension in my pelvic floor persist? Why is it continuing? What is its cause? And I would say to you simply, this is muscle tension. But what is the cause of muscle tension in the pelvic floor? In a great majority of cases, when it is a chronic condition, meaning that it lasts at least 3 months, sometimes 6 months, sometimes longer, so it's a chronic condition, it's a persistent pain, it's a persistent tension. The cause is emotional tension, emotional stress. The cause is your brain sending signals to your pelvic floor to remain taut or tight instead of more loose or relaxed like it should be. So why is this happening? In some of my patients, it's because they've been told there's something wrong with their pelvic floor and they're afraid that it won't ever go away. The fear of persistence, the fear of this won't resolve, this won't go away, is a key factor in the perpetuation of the tension in your pelvic floor. So going back further, what kinds of tension and stress on the emotional level might be causing this? That can vary. For some of my patients who are women, it may be related to a sexual assault or to a relationship issue. For some of my male patients, it can be related to guilt about sexual infidelity or a sexually transmitted disease. Sometimes it has nothing to do with this, and it is a location that becomes coincidental. However, it's a meaningful location because it's an area of the body that we don't want to feel pain and tightness. What is causing the tightness? Your muscles are getting signals from your nerves, from your spinal cord, from your brain to remain on guard when they should be relaxing. What causes us to remain on guard? Well, in the short term, it's the fight and flight response, that need to be ready for whatever's happening. And in the longer term, it's anxiety, fear, worry, anger, tension, an inability to let go of the past, an inability to express one's feelings in this area. The pelvic floor is a common area for stress and tension, for TMS or PPD or neuroplastic pain. And I believe it's become more common. And strangely enough, it's become more common during an era where there are more treatments, including pelvic floor physical therapy. These treatments help some people to resolve quickly, but for others, no relief or only temporary relief. And if you're listening to this, you're probably in that category. And so you want to be thinking out of the box, out of the pelvic floor, and thinking about the root cause of muscle tension anywhere in our body, which is typically our mind and brain, through the spinal cord, to the nerves, to the muscles. So think psychologically, not physically, John Sarno said. Focus from the top down, from the brain to the pelvic floor, instead of the bottom up, from the pelvic floor up. And that ultimately becomes the solution. I hope this is helpful. This is Dr. David Schechter, author of Think Away Your Pain and the Mind Body Workbook, Volume 1 and 2. Take care.